Okay, good evening everyone and welcome to the next lecture in our Sussex Universe series. My name is Faith Orchard and I'm a lecturer in psychology, and I'm going to be talking to you this evening about teens and sleep and the importance that sleep plays in our well-being. So I'd like you just to start by having a think about this question. So why is sleep important? What are the consequences of us getting a good quality night's sleep? But also, what are the consequences of having a bad night's sleep? How do we feel the next day? So I'd like you just to pause the recording and just have a think and just reflect about why that might be. So what is going on and why might this be happening? So here are just some of my ideas. Hopefully, or I would imagine you probably had some similar thoughts, but you might have come up with some other ones as well. So we know if we get a good night's sleep, we feel better in ourselves, we feel happier, we're able to regulate our emotions. We're also not going to feel as tired. But we see things like good concentration, better memory, enhanced learning. Also things like actually during the night we forget the information that we no longer need as long as our sleep is functioning well. And then we have some more physical responses as well. So good quality sleep is really important for having a good healthy immune system. Then on the flip side of that, we obviously have similar themes, but negative consequences. So our mood tends to be more irritable. We're more likely to have mood swings. We're obviously going to feel tired and we might feel a bit more sluggish moving around. And then we see these more kind of cognitive effects. So we find it harder to concentrate and pay attention. And we get some physical consequences around actually being much more at increased risks of things like accidents. So this might be car accidents or accidents around the home. Again, because of that kind of lack of attention, lack of concentration that we're able to, that we're going to experience when we're not getting that good quality sleep. So how do we sleep? So I'm just going to briefly talk about kind of the systems that work together to help us fall asleep. So we have two processes involved in sleep and wakefulness. The first one is what we call sleep homeostasis, or the sleep drive. And this effectively works on the basis that the longer we're awake, the more pressure we build up over the course of the night. And then as the pressure reaches its peak, this helps us to fall asleep. That pressure then dissipates over the evening, and then it all starts again the next day. Now, working alongside the sleep homeostasis, we have the circadian rhythm. And this is our body's clock, and it works on approximately a 24-hour clock. And our body then knows what times of the day it should be initiating sleep and when it should be waking up. And to do so, it then releases the correct hormones. So to get a good night's sleep, you want these processes to be working well together. So you want the pressure to be building up so that then when we get to the evening, the body's releasing the right hormones, and these two processes then help us to fall asleep. And you'll see in the figure on the slide that the blue line represents that pressure as it builds throughout the day, and the red line reflects the circadian rhythm, which is fluctuating day and night. So you've also probably heard about stages of sleep, and there are two different types of sleep stage. So we have what's known as rapid eye movement sleep, or REM. And you'll know when someone's in REM because what you'll see is that their eyes are darting quite rapidly. And actually, when we look at brain recordings, the brain activity is also really rapid, very similar to when we're awake. Also, what's happening during REM is that we're most likely to be dreaming. So our brains are really active during REM, really busy. Then in the non-REM stages, which are the remaining stages, this varies then from the light stages of sleep in stage 1 up to the much more deep stages, so stage 3. And these can be differentiated if we're doing measurements of sleep by looking at things like brain activity, heart rate, breathing and temperature. And we combine all of this information to give us a really good indication of which stage somebody might be in. Now, this graph that I'm just showing you here is what we call a hypnogram, and this represents the time we spend in those different stages over the course of the night. And what you'll notice is that it actually changes. So in the earlier parts of the night, we're much more likely to spend time in the deeper stages of sleep. And then as we move towards the morning, we spend much more time in REM sleep. You'll also see that there are some suggested brief awakenings that occur, and this is really common. So this is a kind of an expected sort of normal pattern of sleep where we do wake up briefly. We might not even notice that we're waking up, but this does happen again more towards the earlier hours. Okay, so moving on then to thinking about young people and how sleep develops. So sleep changes massively from our early years of life through to adulthood. And in that first year, there's a lot of things happening. So the body clock's starting to develop so that we start getting some sleep timing. And the body also starts producing melatonin, which helps initiate sleep. And this is, isn't produced by infants when they're newborn. It actually comes through breast milk. But as infants grow, they start producing their own melatonin to help initiate their own sleep. What we also see is sleep quantity reduces. So from 6 months, where we might see around 12 to 16 hours sleep a day, this gradually reduces. And then at 1 year, we might be talking more about 11 to 14 hours. So we see this kind of gradual decline in how much sleep infants need. And in terms of the problems that children are likely to encounter, or rather parents are likely to encounter, at these very early stages of life, we're mostly talking about problems around safety during the night and managing routine. So starting to try and generate routines so that parents can get a better night's sleep. Then as we start moving into the preschool and school age years, again, we see that continued reduction in sleep, gradually reaching around 9 to 12 hours as we hit sort of primary school age. But we see during these ages a much wider range of sleep problems that can emerge. So this might include things like refusing sleep, having nightmares or terrors, but also movement problems, so things like teeth grinding. There's a really, really wide range of difficulties that people can experience during the night, and these can begin to present in childhood. So I'd like to focus a little bit on adolescence today, which is my area of expertise. And I guess it's important to say before we talk about the specifics is that individual sleep need is really variable. So each person will need something a bit different, and that's both in terms of how much sleep we need, but also the routine, the timings in which that happens. So you've often heard people talk about either being night owls or larks. And again, this is an individual difference. So some people will want to, or their bodies will naturally stay awake later at night and they'll have longer lie-ins in the morning. Whereas you'll get some people who are the larks, who like their early nights and their early starts. And there's not any problem with either. These are just natural variations that we have. And teenagers will show this as well. Now, in terms of sleep quantity, we've said that this is continuing to decline. And when we get to adolescence, the recommendation is about 8 to 10 hours sleep. Again, we have that kind of range of times because, as I've said, there's a lot of individual variability. But there is some suggestion that about 9.5 hours sleep is probably optimum. However, in teenagers worldwide, the evidence actually suggests that less than a third of young people get that recommended amount of sleep. Now, I'd like to talk to you about why that might be. And I'm really nicely going to draw on a very famous term that was coined by Mary Carskadden back in 2011, the perfect storm. And this really highlighted how there was such a huge range of factors that make teenage sleep so vulnerable and particularly at risk of sleep problems. So as part of this perfect storm, we see factors around our biology, our psychology, but also the influence of society. And I'd like to just talk very briefly about some of these factors. So you'll be very familiar with the fact that teenagers are going through masses of kind of growth and change, in particular probably puberty being one of the biggest changes. But alongside puberty, what also happens is a change to that circadian rhythm that I mentioned at the start, that body clock that tells us what time to go to bed. Now, during our teenage years, we see a shift to that circadian rhythm. So young people are much likely to fall asleep later than when they were children, but also than adults. So when we become adults, that body clock shifts back again. So this is very unique to teenage years, and it might mean that teenagers are struggling to get to sleep until more like kind of 11, 12 o'clock at night. And similarly, their bodies want to get up then later in the morning. Then thinking about psychological factors, here we have influences much more around socialising. So teenagers tend to socialise in the evenings. This might be at weekends, but also in the week. If not in person, this might be online using social media. Then the final factor, and this really is quite a big one, is the influence of society. Now, there are some kind of more cultural factors here around perhaps increased caffeine use, but the big one that really influences teenagers pretty much across the world is school start times. So if you think about that circadian rhythm shifting, the school start time doesn't shift to compensate for that. So teenagers are still getting up at the same time, perhaps 6:30, 7 a.m. maybe for school, depending on the travel that they have to do. But this really doesn't align with the fact that their bodies don't want to go to sleep until perhaps 11:30. So the consequence over the school week is that this kind of chronic sleep loss is experienced, where teenagers are really kind of underachieving what is needed for them to be able to function. Now, this also leads to what's known in the research field as social jet lag. So this is happening during the week. And then at the weekend, what happens is we have these social pressures around socialising, but that chronic sleep loss also means that we are more likely to have long lie-ins. So we're up late socialising, and then we have a longer lie-in on a Saturday and a Sunday. But on Monday, we have to get ourselves back again, so back to early starts. Now, these constant fluctuations for our circadian rhythm, backwards and forwards, lead to the same feelings that we get when we experience jet lag. Because all that's happening is the body clock is being forced to move. Now, not only this, but it's also the worst kind of jet lag. So it's like travelling east to west, so perhaps New York to London. And this happens every Monday morning for pretty much every teenager. So I've spoken about normal teenage sleep problems, so problems that almost all teenagers are likely to experience, but there are also some sleep problems that are less common and perhaps more challenging to face. Now, in teenagers, there are a few particularly common sleep problems that I wanted to outline. The first one is insomnia, which I'm sure you're familiar with. Most people think of insomnia as not being able to get to sleep, which is true, but it also can be characterized by waking up during the night, not being able to get back to sleep, or waking up too early in the morning. In teenagers, we might also see hypersomnia, so sleeping too much. This is probably less common in teenagers who are attending school, but it might happen when they're not attending school. And then another particularly common disorder that we see is what we call delayed sleep-wake phase disorder. So this is when that circadian shift that I've mentioned is actually much more extensive. So not falling asleep until the hours of the morning rather than late hours of the night. There are also many other sleep disturbances that I'm not going to talk through today. In fact, for the remainder of the talk, I'm mostly going to focus on insomnia. Now, I said at the start that we would talk about the link with well-being. And sleep problems occur commonly along many emotional and behavioural difficulties. And this includes things like anxiety, depression. You might be familiar with it being part of ADHD as well. That's quite commonly discussed. And sleep is common amongst all of these things, but some problems are very strongly characterised by sleep disturbance. So one example of this is depression. So in a study a few years back, it was found that sleep problems were actually more common than low mood as part of a depression diagnosis in teenagers. In fact, I think they found that 92% of the young people were experiencing sleep problems. So we see sleep as a real difficulty in some mental health problems. But there's also very interesting emerging evidence that started to try and understand a bit more about the relationship between sleep and mental health, and in particular whether or not sleep problems might trigger or lead to future mental health difficulties. So this was a study that I was involved in that came out last year, And this drew on data or a very famous study which you might be familiar with called Children of the 90s. So back in the early 1990s, pregnant women, about 14,000 actually pregnant women were signed up to take part in this study. And the idea was that they would follow the parents and their children, their family members, for the subsequent years to study child development. The study's actually still ongoing, so the children and their families are still completing measures today, which would make the children, I guess, around 30 years old now. So we were very fortunate to be able to use this data to answer some questions about the relationship between sleep and mental health. So at age 15, around 5,000 young people completed measures of their mental health and also measures of what we call sleep patterns and sleep quality. Now this refers to the time, so the sleep patterns refers to the timing of our sleep, so what time do we go to sleep, how long were we asleep for. And sleep quality refers more to how good it was. So did it take us a long time to fall asleep? Did we wake up in the night? Were we particularly tired the next day? And then in addition to this age 15 data, there was also measures of mental health at later time points as well. So at age 17, 21 and 24. Now, this data allowed us to look at whether or not those problems with sleep at age 15, or the patterns of sleep at age 15, whether they actually might predict future anxiety and depression later into adolescence and into early adulthood. Now, what we found was that there were some significant relationships. So for sleep patterns, the amount of time young people were asleep on school nights was a predictor of future anxiety and depression at all of those ages, so 17, 21 and 24. So what this means is that the less sleep someone was getting on a school night, the more at risk they were of future difficulties with anxiety and depression. We saw similar patterns for sleep quality as well. So the more sleepy you were during the day, the more you were awake during the night. And also if you had this perception that your sleep quality was bad, these all put you more at risk of future anxiety and depression, again, at all of those ages. Now, this really highlights for us the importance in targeting sleep and what we can do to support both adults and adolescents better with their sleep habits. So for the final part of the talk, I would like to just talk a little bit about some of the psychological approaches to improving sleep, and in particular some work that we've been doing. So I'm not going to spend a lot of time on this, but I just wanted to briefly outline some of the approaches that are used in psychology to treat sleep problems. And these mostly come from cognitive behaviour therapy for insomnia, or CBTI, which has got really good evidence across adults and adolescents. It can also be used with children, but it is adapted slightly. So I'm talking mostly here about the adult and adolescent version of the programme. And in the box on the slides, apologies for the lots of text, I will briefly talk through it. But these are all the different components of the therapy. So we'd be doing education around what sleep is, and psychoeducation, so the relationship between sleep and well-being, particularly negative cycles. So things like the more stressed we are, the harder it is to sleep. And then the harder it is to sleep, the more stressed we become. We'd also be monitoring sleep to see really what's going on. And then we'd start some of the more cognitive and behavioural techniques. So challenging thoughts around sleep, creating good routines, so avoiding technology before bed, creating good relationships between the bedroom and the bed and sleep. So making sure that the body knows when it gets into bed that it's ready for falling asleep. So this is things like, you don't want to be studying or working in bed because then you're creating an association of activity. Then the final component is what we call sleep restructuring, where we actually use sleep diaries to move the sleep time around so that it fits into the optimum window, so that the individual is going to fall asleep quickly and wake up at the right time. So we've actually done a bit of research around the impact that these treatments have on mental health as well as on sleep. And I was involved in a meta-analysis along with some colleagues at the University of East Anglia and Norfolk and Suffolk NHS Foundation Trust. This came out a couple of years ago. And what we did was we looked at all the research that had examined the effect of these psychological treatments for sleep, but looking at the effect on depression. And we found some really large effects. And what this means is that the sleep interventions were significantly improving depression as well as sleep. Unfortunately, however, there was very little research in young people. In fact, there were only 4 studies at that point in time, and none of these had included young people who had elevated levels of depression. These were just community samples. So this led us to wanting to kind of establish our own program of research around this, which we call the Sleeping Better program. And this was developed in collaboration with Jason Ellis, who's at Northumbria University. And we developed a nice brief program, 4 weeks, but all of the content is really delivered in the first session. The following sessions are just checking in. And this was for young people experiencing problems with insomnia, but suitable for young people with anxiety or depression as well. There were a few adaptations made from the adult version, so things like making sure parents were involved to keep young people safe and support them, and to be very aware of some of those developmental challenges around the circadian rhythm. So I'd like to just briefly, for the last part of the talk, just talk you through a case study from the Sleeping Better program. So this is Sophia. Sophia was experiencing anxiety and insomnia when we saw her in our anxiety and depression in young people service. This is when I was working at the University of Reading. And Sophia, which is not her real name, I should add, Sophia had had a very long history of insomnia, and although she'd recovered from her anxiety, she was developing problems with depression, and the insomnia was still ongoing. As part of her depression as well, unfortunately, she was experiencing some very difficult symptoms around self-harming and having some active suicidal thoughts. So she was offered the Sleeping Better program, followed by treatment for her depression. And I'd just like to show you some of the data from her sleep. So parents attended 3 of the 4 sessions, and we actually did those 4 sessions over a 6-week period. So you'll see that data in a moment. But I wanted to highlight some particular points here. So it was taking Sophia about 2 hours and 20 minutes on average to fall asleep before she started the treatment. And she was getting under 6 hours sleep per night. So this is well below that recommended 8 hours sleep. And you'll see here, if you can see those numbers on the slide, although I will just talk through some of them, that if we start with how long it took to fall asleep, which is what we call sleep onset latency, which is on the first row, by the second week, that 2 hours, 20 minutes is down to 5 minutes. And that is simply through those techniques of changing the environment, moving the sleep patterns around so that we're getting optimum sleep. However, the sleep time takes much longer to adjust. So you'll see from the bottom row that 5 hours, 50 minutes that she was getting at the start was at over 6.5 hours by the 6th week. Now, that is a lot more sleep per day. If you think over the course of a week, that's really going to add up. But that's still well below the 8 hours. So what we would expect, what we would hope families would do, is continue these techniques, and we'll continue to see that sleep quantity increasing over the later weeks. Sorry. Sophia gave us some really nice reports about her experience as well. So she described feeling less tired in the day. She wasn't drifting off during school anymore. She'd also, which was a really nice positive finding, linking back into those impacts on well-being, she wasn't experiencing those risk symptoms around self-harm and suicidal thoughts anymore. And she actually decided not to pursue treatment for depression. That she was kind of feeling well enough in herself to continue as she was. She also gave us some nice data around how it felt supportive and focused on her sleep quality. So then, thinking about going forwards with the work, we've been doing this initial pilot work, which has been going on for a few years, and we're now looking at whether we can adapt the programme and make it suitable for a school context so that we can reach more young people. We've done the initial pilot work for this, and we're currently looking for research funding to evaluate this on a wider scale, which hopefully means that at some point in the future this is something that will be available for more families to access. That's everything I wanted to talk about. So thank you so much for listening. I really look forward to the Q&A that's going to follow this session. I just wanted to highlight some resources in case you wanted to learn more about sleep problems. So there's some really nice general sleep science books available, and I've recommended one by Alice Gregory called Nodding Off. If you happen to be parents of poor sleepers yourselves, there's a really great self-help guide book written by Rachel Hiller and Michael Gradisar called Helping Your Child with Sleep Problems. And then in case there happens to be any clinicians or professionals out there, there's also some really great resources for actually delivering sleep interventions. So thank you so much for listening, and I look forward to